Very good evening, everybody. Meeting again with a new remedy in this session. We are discussing remedies from 30th syllabus as well as from B series. And all remedies are very useful remedies in our day-to-day practice. Today, we are going to learn one more. That is the bromium. I will share two cases of bromium. Interesting cases. Both cases were interesting because one was child. He is still on my treatment. It is a 1.5 years child, premature child, delivered 7 months of pregnancy only. He was very weak, delicate, fair child, was brought to me with a tremendous weakness and recurrent cough with breathlessness. He was, since birth, he was continuously on antibiotics and all those sprays because he used to get a severe breathlessness over there. You used to get a lot of cough. If you sit over here and you can listen that rattling over there. It looks like a rattling of antim tart. Very strong rattling was there. But when I examined him clinically, I found the chest was clear. From where this rattling is there? It was from throat. Whole collection was there in the throat, and mother told that he used to get cough off and on. He used to get very breathless whenever the cough settles over there. When he vomits, then he feels better, and vomiting is full of cough. So I saw that there is a tremendous collection over there in the pharynx, larynx, the whole throat. And when he was carried by his mother, interesting thing was that I asked him to keep him down, and she said it is not possible. He never leaves me or my husband, continuously has to be carried. Only when he is not having the cup and he is normal, only during that time he plays alone. Otherwise, we have to take him continuously. That was another important thing which I observed. Third thing which I have observed, that I was just asking, "What's your name?" And I was trying to talk with him, and he used to just pronounce the words, but it was not possible because of curve. That was another thing which was present in him. When she tried to keep him down, he started crying, and during crying, there was a tremendous cough, mucus comes out. There was continuously movement of alienizai. It was going on, and I have checked him on her when child was on her lap only. I have checked, examined with the stethoscope, found nothing in the chest, but whole thing in the throat. I tried with the light to, with the help of a battery to see the throat. And one important thing which I have noticed, that there was a congestion as if a whole network of blood vessels over there. And when I examined him properly, there was also a network of blood vessels over here. So I asked, since when this is there? They said it is there right from the birth. So when I have went through the case, I was thinking first of antim tart, but child was not that dull, which is there in antim tart. Then second thing, the tongue was little bit coated, not absolutely clean, but child was drinking the water. That is also one important thing which was present. Third important thing which was observing, that he was doing like this continuously. He used to do this, he used to do this. I asked whether he feels sleepy or whether he does it whenever he is sleepy. They said, yes, we feel that earlier, but we don't know. This is his habit. He used to do that again. So I went through the repertory. There are two important rubrics which I have got. First important rubric was that carried desires to be carried, crow pin. A single remedy rubric was bromium. It was bromium. Second rubric which I have considered, that throat redness network of blood vessels. Again, a bromium single remedy was given. Third rubric which I have considered in the case skin redness network. It was looking like a hemangioma. It was there. Again, there was a bromium for 3 marks in that rubric. And in bromium, whatever I have learned is that bromium has the whole collection of mucoid cup in the larynx specifically, or in the throat. Antimatat has it in the bronchi as well as the bronchioles. That is the big difference between the antimatat and bromium. So I have selected bromium. I have given bromium 30 to the child, repeated for 10 days. Bromium requires repetition. If you read the Borix Matramedica, he has written one sentence that use persistently at least for 10 days. That is the sentence which is used by Boric in his book. So I have repeated the bromium in that child, and to my surprise, he was completely relieved from his cough. He was not having the cough when he was brought after 10 days. The chest was clear and child was too happy. She kept him on the examination table and he was not waved. That is a very important thing. That was interesting. So remedy has acted at all levels, and all those features indicating very specifically the bromium. And that was the first case in which I have utilized bromium in this manner. And all 4 rubrics which I have considered, that carried desires to be carried in Kraupin, then sensation of cobweb on face, that is another feature which is there in bromium. Then throat redness networks of blood vessels, single remedy bromium, and skin redness network, Barataca, Borax, no, bromium, and 2 more remedies are there. And I have selected bromium. That was the interesting case. Second important case was a just 32 years of lady. She was brought to me right from Odisha, Sambalpur. She had a CA breast, left breast, and she was advised, she had a big um, tumor in the left breast and it was found to be malignant, and it was asked that she should go for mastectomy, radical mastectomy, but she was quite afraid of it, and she was so disturbed, depressed, and she was brought to me. Actually, their train was too late, so actually they should reach me at 11 o'clock in the morning. They reached me at 8:30 in the evening, right from Odisha, from Sambalpur. And when she first time I met her, I examined that stony hard tumor was there in the left breast. It was painful, pains radiating to the left axilla, and there is also swelling in left axilla. And she was not allowing to touch that because she said that whenever I touch, pressure always aggravates her pain. That was another characteristic. Her face was absolutely sad, and it was found to be because actually she was just 32 years of age and she was found to be a malignant. So that was first important thing which I have noticed. Second important, she was so disturbed. She was continuously talking about her disease and everything, and about her family and every problem, and she was just talking in a large harsh sound. It is a big sound, and she, as if she was wailing, she was lamenting. So that was interesting in her case, that it looked a little bit different for me. So I was considering her case, then I opened the repertory. I have seen few rubrics. One rubric which I have found over there, that sadness cancer of mammy in. Sadness, cancer of mammy in. That is very important rubric which is given in complete repertory. Bromium is single remedy mentioned over there. And second important rubric which was there, lamenting horse. Again bromium. Third important thing, that left breast stony hardness, cancer, bromium is the remedy. When if the pains are there, also extending to the axilla, the bromium plays very vital role. So pressure aggravate, that is another thing which I have considered. And then I have started her on bromium 11. And I have repeated for you. I have bromium 1, 2, 3, 4, 5, 6 continuously. She was under my treatment for nearly about 2 years. And to my surprise, that started reducing. The big tumor in left breast started reducing. It has reduced to much a small size, much small. And then the pains have stopped. She was quite good, happy in fact, because pains have been stopped. Then what has happened, that someone have advised that to take the opinion of a cancer surgeon. They went to the cancer surgeon. He said, by any means you have to remove this growth. It was removed. It was a case nearly about 2017. It was removed by them by surgical intervention. But till that period, with the help of bromium, she came to so nicely to the such a state that thereafter till today there is no recurrence. In fact, they have sent me a lot of cancer cases from their area. But it was interesting that both cases, pathological cases, where bromium worked very nicely. Rubrics: sadness, cancer of mammy in. That is one rubric. And second rubric is lamenting horse. These are two rubrics. So let us open your Allen's keynotes. You'll get bromium over there, bromine, the element. It acts best, but not exclusively, on persons with light blue eyes, flaxen hair. Flaxen means it is light yellow, brownish, or little bit dark brown. Flaxen hair, light eyebrows, fair, delicate skin, blonde, red-cheeked, scrofulous girl. So this is very typical constitution which has been mentioned in the first line by the Allen, and this constitution, but it is not always that it should be like that. But this is a constitution which has been mentioned in first paragraph. Then see the sensation, that is very typical. Sensation of cobweb on the face, like Baratakab, like borax, like graphitis. This remedy is also having, and they don't know, child doesn't know what is there, but they goes on cleaning the face. You have to catch that. You have to understand. This is a perceiving. This is not the thing which patient will going to tell you every time. So these are things which you have to catch, and you can find it out. Fan-like motion of alienage, very important rubric, which is again observational rubric. Antimtat, yes, pneumonia in antimtat and lycopodium is there. Here, pneumonia, instead of pneumonia, it is more of the laryngeal secretions or pharyngeal secretions which are there. There is a cough and then fan-like motion along with that present. Sailor suffers from asthma on seashore, on shore. That is very important feature which I have mentioned. Stony heart, scrofulous or tuberculous swellings of the glands. This is stony hardness, the cona maculatum, the calcarea fluor, like this bromium, iodum also, stony hard glands are there. This is also one, stony heart scrofulous. Scrofulous means glandular affections, enlarged glands. Tuberculous swelling. So it is a remedy which goes toward tubercular to cancer miasm, especially on lower jaw and throat. So lower jaw and throat, there is swelling specifically in thyroid, submaxillary gland, the parotid glands, the testes, the mammary glands. This is the wonderful remedy when the such type of stony hardness if you get. or scrofulous affections are there. Diphtheria, where the membrane forms in the pharynx, beginning in bronchi, trachea, or larynx and extending upwards. The chest pains running upwards. There is a chest pain and which runs in upward direction. And whole site of action is more commonly on the larynx and pharynx, because of which that there is a hoarseness. Mucous membranes and diphtheritic cough. Cough, these are the cough which is developed because of larynx or pharyngeal secretion. Much rattling of mucus during cough, but no choking, as in HEPAR. Sounds loose, but no expectoration, like antihypnotic. So cough, it looks like it sounds loose, but it is not easily coming out. And whenever it comes out, it comes in the vomiting. Croupy symptoms with hoarseness during whooping cough, gasping for breath. There is one important feature which is there in the bromium. Inhalation is difficult in bromium. They cannot inhale properly. That is very typical with the bromium. Dyspnea cannot inspire deep enough. See, this is very characteristic of bromium. As if breathing through a sponge or air passage full of smoke or vapor of sulfur, there is rattling, sawing, voice is inaudible. They cannot, the voice is inaudible because the larynx is full of phlegm. Danger of suffocation from mucus in larynx, that is very typical of this remedy. Danger of suffocation from mucus in bronchi is antihypnotic. So in antihypnotic, you get the rattling over here in the chest area. You auscultate and you get crepes, more crepes. In bromium, crepes are not at all there in chest, but you see their cuff is there right from pharynx. So this you have to differentiate. If you are able to differentiate, you can catch remedy very easily. Because antihypnotic and bromium looks very similar. Both of them are having motions of wingspan like both of them having rattling curve. But antihypnotic is more dull, dizzy, drowsy. Bromium is not like that. Bromium is irritable little bit. Bromium always wants to be carried. That is very typical with the bromium. Hypertrophy of the heart from gymnastics in growing boys. Very typical feature of the bromium. This is because overactivity of the or over exertion from the gymnastic activities producing hypertrophic heart. From calisthenics in young girls. Calisthenic means exercises in order to do a beauty, or for the beauty they do certain exercises, that is called as calisthenics. So from calisthenics in young girls, the remedy is causticum. Physometra means passage of flatus from vagina. Loud emission of flatus from the vagina, like lycopodium. Membranous dysmenorrhea. Day before yesterday, we have learned the remedy, membranous dysmenorrhea. We have seen it in borax also. It is there little bit, it is there in bovista also. This is one more remedy where membranous dysmenorrhea is there, like caninum. Cold sensation in larynx on inspiration, like rustox and sulfur. These, if elder peoples are there, they always complain that whenever they inhale, it feels cold inside the throat. Cold sensation feels better after shaving. It doesn't have any specific significance, but after shaving, they feels better. Aggravated after shaving is carboanymlase. See the relationship. Compare in Croup and Croupy affections the chlorum, the heparsal, the iodum, and the spongia. Spongia, the similar type of feeling, or spongia is also a remedy where you will get the similar spongy feeling in the chest like a bromium. Both remedies are having glandular affections. Bromium specifically has very typical with the larynx. Spongia, it is there with larynx as well as lungs. Hard goiter cured after iodine failed. So hard goiter, this is one more remedy after conaium, after iodine. This is one more remedy where you can get calcarea fluid. You can use it in 6-6 potency in such types of cases. Bromium has cured in crowd after failure of iodine, phosphorus, hepar, spongia, especially in relapses after the iodine. If it is recurrent, not getting settled with those remedies, bromium is one remedy one should not forget because it's deep acting remedy. He says the action is nearly about 20 to 30 days, bromium. The chief distinction between bromium and iodine is that the former cures the blue-eyed and latter cures the black-eyed patients, as Herring has rightly said. This is his observation. You cannot claim why. These are observational features mentioned by the stalwarts. We just check it in our practice, confirm it in our practice. That is our duty. And this remedy is antidoted by ammonium carb, camphora, maccarb, and opium. There are four antidotes for the bromium: ammonium carb, camphora, maccarb, and opium. So this is a wonderful remedy for respiratory tract affections, specifically the URTI as well as LRTI. But the more secretions are there in the larynx associated with glandular affections, the throat, the thyroid, the submaxillary, the submandibular, the parotids, even it acts on testes, it acts on breast. So very specifically action on the glandular system. So scrofulous diathesis one should not forget with bromium. Left breast affection, very important. A cancer of breast, left breast associated with axillary nodes affection and pain in left axilla. This is one important feature one should not miss. A sadness specifically in such types of cases is characteristic about this remedy. Then the few rubrics which we have learned, that is the carried desires to be carried constantly, specifically during crop. Single remedy mentioned is the bromium, and I have seen it many times. We miss it because generally we overlook towards the sub rubrics of carried desires to be. We used to see carried desires to be carried fast or slow, but not other rubrics. This is one remedy, one rubric I used to always look for that, and if it is there, it is you never fails with bromium. So this child never likes to be keep them down, specifically whenever they are coughing, and motions of being span like that is another feature which you can find. These are delicate children. Their quite skin is white, fair, very quite fair, and these are the generally used to found very irritable when they gets cranky whenever they have crowd, but there is always an hoarseness. So we have learned one more remedy from B series. Tomorrow we'll meet again with some any other remedy. So that's all for today. Any query is there? Yes, we can discuss. Otherwise, we'll stop.
Sir, if the symptoms are there and the right breast tumor is there, can we give this remedy?
If the rest of the features indicates bromium, you must give it. You must.
Even right breast.
Yes, even right breast. If the symptoms, rest of the symptoms matches, you must give it. Definitely.
Thank you.
So, sir, can it be indicated in tonsillitis? Not markedly in tonsillitis. It is more of pharyngitis, laryngitis. More commonly in pharyngitis and laryngitis. Tonsillitis, if symptoms matches, you can use.
Sir, fanning of Elanesa is the marked feature of cardiac cough or cardiac asthma. So it can be given in that also.
Not only, don't consider like that. Consider this is one feature. You just correlate rest of the features of the remedy. It is very important that mm, you should not make your prescription on single symptom. At least three important characteristics you should get it. In sadness, in cancer, in mammy, should it be given in higher potencies? No. It is always, whenever pathology is marked, Should not go for higher potencies. Always better to use the LM potencies. LMs are better. So that's all for today. Thank you and good night. We'll meet tomorrow again for both the lectures.